Health Minister Dr. Frank Anthony on Friday, during his COVID-19 update, announced that Guyana could see two additional COVID-19 vaccines, the Sanofi GSK and the Novavax, once the trials are completed and approval is given by the U.S. Food and Drug Administration, FDA, for distribution and administration.
But that's another vaccine that has been added or would be added shortly to the vaccines that we already have. In addition to that, there's another one that is going through emergency use authorization by the FDA, and that's the Novavax vaccine.
Anthony posited that based on reviews, the new vaccines are said to be 100% effective in preventing severe symptoms of COVID-19 and hospitalizations.
The latest clinical trials, the phase 3 clinical trials, they have shown that the vaccine is 100% effective to prevent severe disease from COVID-19 and to prevent hospitalization.
The French and British Sanofi and GSK companies, which are manufacturers of the Sanofi GSK vaccine, are currently seeking approval from regulators, including the European Medicines Agency, while a review with the United Kingdom regulator, the Medicines and Healthcare Products Regulatory Agency, is already underway. Minister Anthony revealed that the U.S. plans to consider the use of the Novavax vaccine, which has already started shipping doses to the European Union and Canada.
The U.S. now is considering it, but it has already gained approval in Canada and in the EU, and it's becoming more and more available. So these are two new vaccines that we certainly are looking at to see how it progresses and whether we would want to adopt them for use here in Guyana.
A separate trial showed that the jab boosted antibody levels against the virus 18 to 30 times across all age groups when used in people who had been given 2 doses of other vaccines, such as the Pfizer-BioNTech, Moderna, and AstraZeneca shots. This comes in line of the emergence of several variants of concern, such as Omicron. Meanwhile, Anthony also announced that his ministry will soon consider the U.S. Center for Disease Control (CDC) recently updated recommendations for the use of the Pfizer vaccine being given to adolescent boys, which states that they should consider waiting up to 8 weeks between the first and second doses instead of the 3 or 4 weeks previously recommended. As it relates to local vaccination, 431,597 adults have received a first dose, while 326,867 persons are fully vaxxed. In the adolescent category, 33,476 have at least one shot, while 24,134 are fully vaccinated. To date, 49,742 persons have received their booster doses. Reporting for DHP Nightly News, Joel Vogt.